Thank you very much. The next item of business is a statement by Jean Freeman on health and COVID-19. The Cabinet Secretary will take questions at the end of her statement, and so there should be no interventions or interruptions. I call on Jean Freeman.
Thank you very much, Presiding Officer, and thank you for the opportunity to update the Chamber on several key areas around our response to COVID-19 and to say something about our future planning. Today is International Workers' Memorial Day, and across Scotland many people observed a minute's silence to particularly honour health and social care staff who have tragically died during this pandemic. A number of our own colleagues in Scotland have lost their life to COVID-19, and my thoughts, and I know those of members across the Chamber, are with their families and loved ones. In the last 24 hours, 70 deaths have been registered of patients who have been confirmed as having COVID-19, and that takes the total number of deaths in Scotland under that measurement to 1,332. As always, it is so important to remember that behind each one of those numbers is the loss of someone loved and now much missed, and I offer my sincere condolences to their families and friends. Presiding Officer, notwithstanding all of that, we are starting to see some promising signs that the efforts and the sacrifices that the overwhelming majority of people across Scotland have made are having an impact. The number of patients in hospital with confirmed or suspected COVID-19 has been broadly stable in recent days, and the number of people in ICU with COVID-19 has shown signs of decline. We should not read too much into all of this yet. These are early days, but these trends are both welcome and cautiously hopeful. As of today, 50% of adult care homes have reported an outbreak of suspected COVID-19. Last week, I set out a series of additional steps to support those who live and work in our care homes. These steps increase the clinical support focused on preventing COVID-19 infection and transmission and care homes. Our NHS Directors of Public Health are now providing enhanced clinical leadership and have contacted every care home in Scotland. They are assessing how each home is managing infection control, staffing, training, physical distancing and testing. We have provided a direct delivery of PPE to care homes and have worked with local partners to significantly improve the operation of local PPE hubs. Whilst the supply of PPE is primarily the responsibility of care home providers in both the private and the public sector, we will continue to provide both top-up and emergency provision to ensure staff have what they need and they and the residents have that protection. Work is also underway to ensure that all COVID-19 patients being discharged from hospital should provide 2 negative tests before discharge, and that all new admissions to care homes and all residents who are symptomatic should be tested, and those new admissions should be isolated for 14 days. Social care and care home staff continue to be priority key workers for testing, and I have written to all care homes reminding them of this and asking them to make sure that as employers they follow through where this testing is required. As members know, we also have over 21,000 returning health and social care staff alongside student nurses, student midwives, AHPs and newly graduated doctors, all willing to apply their skills and experience to the collective effort. Many of them are able to work in both the care and the primary care setting, and as of today, 185 applicants have been matched into roles in care homes and care at home services, and a further 218 are ready and available, and I expect the number of matches to increase rapidly in the coming weeks. As well as those working in care homes to protect our most vulnerable people, I know there are many carers, both paid and unpaid, who are supporting people to stay in their own homes, and they too must be protected. So we've extended the provision of PPE to personal assistants and unpaid carers. From the start of this week, the local PPE hubs for the registered social care sector are receiving enhanced supplies and support so that they can distribute to the whole of the social care sector where normal supply routes have failed. We have published advice for unpaid carers on the appropriate use of PPE and how to access it, and will be publishing equivalent guidance for personal assistants shortly. I've asked the national carer organisations and local carers centres to discuss with carers their needs and help us with directing them to their local hub where they need PPE. We will ensure hub locations are clearly signposted on the Scottish Government website, and health and social care partnerships are working with local carer centres to make clear how individuals can get the necessary personal protective equipment. Throughout this difficult time, it is critical that social care support is maintained to ensure the safety, dignity and human rights of people who already receive that support. In addition to the funding directed towards social care from the 2021 budget, I reached agreement some weeks ago with COSLA that we would meet additional costs incurred because of the impact of the pandemic. That agreement was specifically reached to ensure that both existing and new demand and need could be met. Alongside this, those additional returning staff I mentioned a moment ago are also available for deployment to these services to ensure staffing resilience. So it is not acceptable to me that care packages are cut, in some instances by 100%. I expect the steps I've already taken to be used, and if there is more that needs to be done to ensure existing packages are not cut and new demand is met, then I hope colleagues in the sector know that my door is always open, and I expect them to come to me with those additional requirements. I want to turn now to testing. By April 22nd, 17,800 health and social care staff or symptomatic household members had been tested. 21% of those tested were social care staff. By the end of April, all 14 health boards should have local testing capacity. In terms of testing capacity, we are on track to reach at least 3,500 tests available per day by the end of this month, making steady progress from the start of this pandemic, where capacity was 350 tests per day from 2 labs. We also continue to work with the UK Government on its testing programme, which is expanding both capacity and access in Scotland. 4 UK Government drive-through testing facilities are already operational, with a 5th due to open in Perth this Thursday. 5 mobile testing units manned by Army personnel are going live in Scotland this week, and it is anticipated that a further 8 units will be live in Scotland within the next week or 2. This increased capacity in our own NHS labs and through that participation in the 4-nation testing exercise has ensured that we are able to expand the areas and the groups who are being tested. So we have increased availability to key workers beyond the health and social care sector using the categories that we have outlined before, and have today also increased testing to all 70-year-old and over admissions to a hospital setting. In terms of access to the UK 4-nation exercise, this is controlled through the queuing system managed by the UK Government and through their digital portal. I want to touch now on 2 other issues before I conclude: research and ongoing changes to healthcare delivery. The pandemic has required fundamental change to how health and care is accessed and delivered. This has involved a significant reorientation of resources and the incredible support and efforts of local leaders, planners, clinicians, in fact, the entire workforce. The work has included preparing to quadruple ICU beds and ensuring there is sufficient hospital bed capacity. Significant increases in digital access for health services, with around 60% of GPs now using Near Me, and weekly digital consultations increasing from around 300 to over 9,000. The reshaping of primary care to support COVID-19 hubs with 24/7 access. Shielding almost 150,000 clinically vulnerable people and focusing multidisciplinary teams working on anticipatory care planning with them, and expanding mental health support by moving towards a 24/7 NHS 24 mental health hub and digital therapies. What is clear is that, in line with our framework for decision-making that was published last week, we need to achieve a careful balance in managing our healthcare capacity going forward including our commitment to continue to treat emergency, urgent and maternity cases. So we will continue to work closely with health boards and our partners to ensure there are robust plans in place to safeguard local resilience and responsiveness, whilst we also consider how and when we can increase the business as usual work of our NHS. The incredible levels of compliance with social restrictions that we've seen show a clear willingness on the part of the people of Scotland to think beyond individual health to population health. As we move to introduce the test, trace and isolate measures required, we will need that focus on population health to continue. Finally, I want to update you on research proposals for Covid-19 that we launched on the 25th of March. 139 proposals were received from across Scotland's universities and research institutes. Following an independent expert review process, 55 projects have been selected for funding. This has resulted in a pan-Scotland portfolio of research with 15 different institutions leading on projects. In summary, the outcome of the call is a programme of projects meeting the aim of establishing a broad Scottish programme of high-quality research on Covid-19 that will be delivered rapidly and inform policy and clinical practice in responding to the pandemic. Presiding Officer, I continue to be grateful for the tremendous resilience of our health and social care staff, our key workers, and most importantly, people all across Scotland. Together, we are making progress, we are suppressing the virus, we are saving lives, and we are showing that we can continue to rise to the challenges of this pandemic. Thank you.
Thank you, Cabinet Secretary. The Cabinet Secretary will now take questions on the issues raised in her statement. I intend to allow around 20 minutes for questions, after which we will move on to the next item of business. And it would be helpful if members would please press the request to speak buttons now. And I call Miles Briggs.
Thank you, Deputy Presiding Officer. Can I thank the Cabinet Secretary for advance sight of her statement? I'd like to raise two specific issues. Over 900 dentists have written to the Scottish Government expressing concern for the future sustainability of the sector. Many dental practices which have a mixed NHS and private patient list are expressing concern that they're on the brink of collapse. Can I ask the Cabinet Secretary what support and plan do ministers have to support them to get through this outbreak? And secondly, the many charities across Scotland are reporting that they have lost 20 to 25% of their income during this period. UK Government have announced £30 million in additional funding coming to the Scottish Government to help support Scotland's charitable and hospice sector. This is very welcome. Can I therefore ask ministers, when will they consult with the Hospice Association across Scotland on how this funding will be distributed?
Cabinet Secretary.
In terms of dentistry, we've already provided additional emergency funding to the NHS General Dental Services budget. Funding provides additional support to dental practices for the temporary loss of patient contributions. I'm happy to advise Mr Briggs following today of the exact amount of that funding, but that funding has already been issued and is in place. In terms of, overall in terms of charities, that is clearly for my colleague Ms Campbell to respond in the wider sense, but in terms of hospices, I can confirm that we will pass on all the consequential funding for hospices that we receive from the UK Government, and we are now in discussions with the hospice network on how best that funding can be apportioned between them.
Thank you very much. Monica Lynn.
Thank you, Presiding Officer. Cabinet Secretary, last night BBC Disclosure programme featuring journalist Sam Polling covered the issues of PPE in great depth, and Sam Polling described the fear among some NHS staff. She put that to the Scottish Government's National Clinical Director, Jason Leach, and he said that's not what I hear when I walk the halls and speak to frontline staff. Now, today is International Workers' Memorial Day, and today we remember some of those health and care workers across the UK have died in the line of duty. Does she recognise that people are scared and are right to raise issues about PPE, and that lack of access to PPE and testing is a widespread and collective issue for frontline workers? What is her advice to those workers who remain concerned? And can I ask on the issue of testing, can she give us an up-to-date figure on how many social care staff have now been tested?
Thank you very much. Cabinet Secretary.
Thank you very much. Thank you to Ms Lennon. I do recognise that fear. I think, but it is entirely anecdotal, that as a result of the many additional steps that we have put in place in terms of ensuring that we have a continuous through flow of PPE, but more importantly, that it is distributed quickly to those areas that require it, and that the guidance is clear. Anecdotally, I think the fear is diminishing, but I wouldn't ever underestimate it, and I completely understand it. If I think back to my own time so very many years ago, I would want to have the right personal protective equipment for the clinical situation or the care situation that I was working in. So I understand that, and I think I've said before, I genuinely do not think, notwithstanding everything that we have done and the more that we need to do where that is raised with us, I genuinely don't think that throughout this pandemic I will ever be able to stand here and say that the situation around PPE is resolved once and for all. I think it will be a constant exercise to ensure that people receive the PPE that they need when they need it, and that they have the confidence and the training to know how to use it, particularly not only how to put it on, but particularly that momentary risky position when you take the PPE off. So I think that staff are very right to raise it. They should continue to raise where they've got issues and concerns. They should raise it with you and with other colleagues in this chamber who should raise it directly with me. And you should expect us to act on that as quickly as we can in order to ensure that those issues are resolved. I think that is entirely right and proper. On the question of testing, of course, health and social care workers have always been a priority for testing. And I think I gave a figure overall, the latest figure I have, about the number of health and social care workers who had been tested, and that 21% of that number were social care. Those numbers will be updated. They're about a week out of date. They'll be updated later this week. There is a clear route for key workers to be tested and for their household member to be tested if that is why they are staying at home. As we expand capacity, we will continue to make sure that we are testing those key workers and widening it, as I've said, to other key workers across the public and the private sector. But the testing capacity and the exercise of making sure that the demand is flowing through for that testing is a piece of work that continues a bit like PPE all the time. And later this week, as the First Minister said, and into next week, as the First Minister said at today's lunchtime briefing, we will have more to say about testing, our capacity, how it is used, and importantly, all the work that we have underway to be able to scale up to deliver that test, trace and isolate operation that is so critical to the next steps.
Thank you. We now move to open questions. Succinct questions and answers, please, to allow as many members to ask questions as possible. Alison Johnson, to be followed by Willie Rennie.
Thank you. The Cabinet Secretary said that she's written to all care homes to make sure that as employers they follow through where testing is required. And we know that people can be infectious when they're pre-symptomatic or asymptomatic, as shown by an increasing body of evidence. So will the Cabinet Secretary ensure that all health and care staff will be tested as a priority? And can the Cabinet Secretary confirm that the 3,500 test capacity will be fully utilised by the end of this month? Thank you.
Cabinet Secretary.
So, we are currently considering that there is, as Ms Johnson said, growing evidence that pre-symptomatic and asymptomatic individuals shed degrees of the virus which make them infectious to a greater or lesser extent. That is new evidence that is emerging that was not there at the start of all of this. It continues to emerge, and with our Chief Medical Officer and other clinical advisors, including the Scottish Advisory Committee on all of this, led by Professor Andrew Morris, they are continuing to consider expanding testing to all health and care staff and whether or not that is the right thing to do. Of course, having expanded it now to all those patients admitted to hospital who are over 70 for whatever reason, what we need to recognise is that the testing happens every 4 days for as long as they are inpatients, and that would apply in the case of health and care staff. So it is an iterative process, because all the test tells you is whether or not you have COVID-19 today, and so it has to keep being repeated. In terms of making use of the capacity that we have set, the 3,500, we will meet that by the end of this month. We are working hard to ensure that the demand is flowing through in order to use that capacity, and we intend to be at least as close to that 3,500 as we can get to in the next few days.
Thank you very much. Willie Rennie, to be followed by George Adam.
I'm concerned about the ability of key workers in rural and remote areas to access a test. That includes the large areas of the Highlands and Islands, the North East, as well as the south of Scotland. Does the Health Secretary know what is the maximum amount of time that somebody would have to travel to get a test in those areas? And how long will it take for those key workers in those parts of Scotland, the remote and rural areas, to have a local and a speedy test?
Cabinet Secretary.
So Mr Rennie is absolutely right. This is an area that has exercised us too for some time. That will partly be assisted by those mobile units, 5 this week, scaling up to 13. They are being particularly deployed in those more remote areas, not only the Highlands, but the south of Scotland, some parts of Perthshire and so on, so that we can take the testing closer to the individuals who require it. Of course, if they are health and social care workers, their health board will ensure that the testing is closely available to them. But if it is through the drive-through centres, then he's absolutely right about the distance that people have to travel. The other initiative that is currently being trialled, again as part of the 4-nation exercise, is home testing kits. And as that has proven to be clinically robust and is being trialled at the moment, that too will be rolled out, and that, of course, makes ease of access much simpler.
Thank you very much. George Adam, to be followed by Brian Whittle.
Thank you, Presiding Officer. Can I ask the Cabinet Secretary what advice you can give my constituents who may have to access their GP during the May public holidays, and what support is currently being made available to them?
Cabinet Secretary.
Thank you very much. This is an important question. As Mr Adam, I'm sure, recalls, we provided additional investment to ensure that GPs and community pharmacy were open over the Easter holiday period. We have again done that to ensure that GPs and community pharmacies are open over the May public holidays. In total, we've made available £8.2 million for NHS 24 community pharmacies and GP practices to stay open over those May holiday weekends.
Brian Whittle, to be followed by Alex Neil.
Thank you, Presiding Officer. I think we're all acutely aware of our frontline NH staff and social care workers are delivering the highest quality care in some of the most demanding of circumstances. They worry every day of the danger they put themselves in and then potentially taking that home to their families. That levels of patient deaths and having to inform families of that loss, of working long hours and extra shifts, which has been described as a situation similar to that which can lead to post-traumatic disorder. So can I ask the Cabinet Secretary what the Scottish Government is doing or considering doing to support our frontline staff in these unprecedented times and allow them the time and support to decompress and to look after their own health and well-being?
Cabinet Secretary.
I'm grateful to Mr Whittle for what is a very important question. A number of our health boards have taken very specific action to create well-being spaces, very practical steps to create spaces near the working environment for people to get a breather, to make a cup of tea and so on, and in addition have made use of particularly digital technologies to provide mental health support to their staff. However, what Mr Whittle is referring to is more than that. It is about the trauma, particularly actually for many social care staff in working with residents that they become very close to. It's the resident's home in care homes or in their own home, and then when those individuals die as a consequence of COVID, that is a very hard experience for many staff in health and in social care. So we are working with Marie Curie, with Scottish Care, with clinical colleagues and others, and in the course of the next week to 10 days, will be able to announce a package of additional support, including access to counselling for health and social care staff. And as we get closer to that, then we will, of course, provide details to members.
Alex Neil, to be followed by Pauline MacNeill.
Thank you, Deputy Presiding Officer. Can I ask the Cabinet Secretary how much the consequentials are for Scotland from the UK Hospice Fund? And in light of the financial challenges faced by the hospices in Scotland, including in St Andrews and Airdrie in my own constituency, and its sister hospice, St Margaret's in Clydebank, supported by my colleague Gil Patterson, once the Cabinet Secretary has agreed the formula for distribution with the hospices, will she consider sending this funding directly from the Scottish Government to the hospices rather than through third parties like the IGBs, which would slow it down and possibly put it at risk of top slicing?
Cabinet Secretary.
Thank you very much. Grateful to Mr Neil for the question. Our expectation, but I should say it is an expectation, it is not yet confirmed, is that the consequential money coming for the hospice work from Hospice UK work funded by UK Government is £90 million. As I've said, all of that consequential funding at whatever level it finally arrives will be passed direct to the hospices, and through the hospice network we will discuss with them, we are discussing with them how that will be apportioned. On the question of direct funding, I'm very happy to take that away and consider it further to see if that is something that we could sensibly do.
Pauline MacNeill, to be followed by Kenneth Gibson.
Thank you very much. Cabinet Secretary, looking ahead, I don't need to tell the Cabinet Secretary how much cancer screening services have saved so many lives. The breast cancer screening, a gold standard service in Scotland, has saved many women's lives, and it's the speed of which tumours are identified, acted on, which surgery has followed on, has been characterised our wonderful service. I would like to ask the Cabinet Secretary, have there been any discussions at all about how and when safe screening services can return? And if there's been any discussion or assessment on how many men and women have missed out on screening and what the consequences might have been in the short period where we have been in lockdown?
Cabinet Secretary.
So I'm grateful to Ms McNeill for what is an important question and one that concerns me significantly, and that is about the unintended consequences of some of the pausing in business as usual in our NHS in terms of health harms that may be caused. I think my colleague Mr Russell spoke earlier in the Chamber about a range of harms that are caused as a consequence of trying to deal with this most prominent harm in the pandemic. In terms of breast screening, one of the difficulties with that particular screening programme is the inability in that to maintain any level of social distancing, as both Ms McNeill and all the women in this chamber will know. So we are looking at, as I said in my statement, if the numbers continue of cases, numbers in ICU, and indeed numbers of deaths, continue to show a decline, then we are creating some headroom inside our NHS. That headroom is fragile, it needs to be protected, we need to maintain a level of protection of it as we go through the next stages, lest we see the number of cases increase. But we also need to consider across government and with colleagues how, if we ease any of the restriction measures, what that might do to case numbers, what that does to what I've described as our headroom, and therefore is there room to restart any of the paused NHS business as usual programmes. And our screening programmes in particular are of a very important preventative health area, in the area of cancer in particular. So they will be factored into what we consider, and we'll have a priority, if it is at all possible, to restart any of those screening programmes. Then Ms McNeill has my assurance that we will do that as soon as we can, and if it can't be soon, then we will certainly set out why we don't believe it can be soon to members in this chamber.
Kenneth Gibson, to be followed by Bill Bowman.
Thank you, Presiding Officer. Cabinet Secretary, in Denmark and Germany, per capita COVID-19 deaths are around a third that of Scotland and a quarter of the UK, Greece and Cyprus a 20th. In the Faroe Islands, 187 people are known to have caught the virus, 181 have recovered, and not one person has died. Portugal's per capita deaths are a sixth of neighbouring Spain's. What therefore is being learned from other nations out with the UK that might help Scotland through this crisis, particularly as thoughts turn to how we can lift the lockdown safely?
Cabinet Secretary.
So I'm sure, as Mr Gibson knows, in terms of our clinical teams, but also our senior leaders in health, there is constant dialogue with their counterparts, not only in the four nations of the UK, but particularly in Europe and in some instances wider elsewhere in the world. All of that learning, all of that tracking of data, paying attention to what is said there, to their experiences, is fed into both the SAGE operation at a UK level, but in particular in the scientific advisory group that we have now in Scotland, as I've said, led by Professor Andrew Morris. So all of those approaches and the ways in which countries have faced this challenge in ways that are comparable one to the other or different one to the other are brought in and continue to be so, particularly now with relevance to how we look at what we might do in terms of the current restrictions, how those might be phased, what easing we may make of them.
Even shorter questions and answers, please. Bill Bowman, to be followed by Gillian Martin.
Thank you. Looking to primary care, I've been contacted as recently as today by constituents who are very concerned about the looming closure of the Abbey General Practice in Arbroath this July, about 6,500 patients. While I understand the focusing of resources on the coronavirus, can the Cabinet Secretary give real comfort to my constituents that they will still have a viable general practice service after July?
Cabinet Secretary.
So the right thing for me to do at this point is to ask Mr Bowman to write to me with the detail of that particular practice and what the situation is. We will then investigate that and reply to him fully.
Gillian Martin, to be followed by Jackie Bailey.
Thank you, Presiding Officer. I was pleased to hear the First Minister announce guidance on face coverings at our briefing today, and the Cabinet Secretary knows that I've been calling for advice on this. Could the Cabinet Secretary outline what the Government's thinking is at the moment in terms of making face coverings mandatory whilst outside, like they have in other countries, particularly as we look at easing any lockdown measures?
Cabinet Secretary.
So, as members who will have seen the lunchtime briefing will know, the Government's position is not to make the use of face coverings mandatory. That is in part because the advice or the science on this is not unequivocal in terms of the benefit of face coverings, but is sufficiently there to lead us to consider that providing the advice that the First Minister set out and is now widely available is the right thing to do. And that is the use of face coverings. Very important that it is not face masks and not the surgical masks that we need for health and social care, but face coverings. The guidance is there for people to use those in situations where social distancing is not possible or is more difficult. But the really important thing I need to say is this is not in any sense a substitute for all the rules that are currently in place, particularly around social distancing, particularly around hand hygiene, and particularly around the current measures, which include staying at home, with the exception of those limited periods for those limited activities that are outlined.
Jackie Bailey.
Every Thursday evening, we rightly applaud the work of health and social care staff, but they need more than our applause. And I hope in the fullness of time their contribution and service is recognised through their salaries, as this is a predominantly low-paid female workforce. But can I invite the Cabinet Secretary to take an immediate step to pay the registration fees for nurses and social care staff this year, something that the GMB has campaigned for prior to the pandemic?
Cabinet Secretary.
So I'm grateful to Ms Bailey for her question, and certainly the sentiments behind that question I'm sure she knows I completely share. I am happy to look at that request from her and consider whether or not how we might respond to that, and to let her know in early course.
Thank you very much. That concludes questions on the statement. My apologies to Stuart McMillan, Anna Sauer and Jamie Halker-Johnson, as we are not able to accommodate their questions, but we must now move to the next item of business.